We're going to be talking about concussion prevention in youth ice hockey, as mentioned, and hopefully we're going to highlight the collaborations with our community partners. So that's actually just what I want to start off with this is really highlighting the strong partnerships between researchers, so included us at the Sport Injury Prevention Research Center, the clinics and the clinicians who evaluate suspected concussions, and the community sport and school partners that really facilitate the ability to do this injury research, including evaluating these prevention strategies. So to start off, this is some research. It's over a decade ago now, but it was a study that showed that the concussion rates in professional hockey in the National Hockey League was quite similar to the rate of concussion we see in Canada in our youth hockey players in the under 13 age groups that played with body checking. And I think when you put that into context, when our Canadian youth players have a similar rate of concussion to professional National Hockey League players, I think we can agree that that's a public health concern. That kind of led to this really seminal research paper led by Dr. Carolyn Emery. This study compared the rates of injury and concussion among under 13 players that played with body checking and compared it to under 13 players that did not play with body checking. And this study showed a nearly four-fold greater rate of both injury and concussion specifically among the under 13 players that played with body checking. Now, that research got into the media, and it was obviously led to a lot of discussions, and eventually led to a discussion meeting with researchers and community stakeholders, and led to this infographic that's on your left there that got published. And just really want to highlight the work that Paul Carson led here. He was formerly with Hockey Canada, he's now retired, but he was really a champion for integrating this research into their decision-making policy. And that's actually what happened in 2013. Hockey Canada made an evidence-informed decision to delay the age to which body checking was first introduced from the under 13 age group to the under 15 age group. So it went from 11-12 to 13-14 age group. Now, since then, a number of local and provincial hockey associations have actually gone above that and have removed body checking from certain non-elite levels of play at the under 15 and under 18 age groups, so previously known as bantam and midget, respectively. And that's why I'm very pleased to have Connie and Jamie as part, because they can give their perspective from their respective organizations. Now, in evaluation of those body checking policy changes, it was shown that in the under 13 age group, there was a 64% reduction in the rate of concussion. At the under 15 age group, based on the point estimate, it was a 40% reduction. Now, this wasn't statistically significant in this age group. However, the all injury definition, which included concussion, was significantly reduced. And at the under 18 age group, a 51% reduction, which was significant. And just to help give some context here, so collectively, these policy changes are leading to thousands of prevented concussions each year. And now since it's been a number of years since these policy changes have been in place, we're talking about tens of thousands of concussions that have been prevented because of these policy changes. And of course, it's important to consider the substantial healthcare cost savings associated with the all injuries, as well as concussions specifically. Now, research hasn't just stopped there, because we really wanted to have a better understanding to ensure there was no unintended injury consequences because of this body checking policy change. So that's what we continued to evaluate after. And that's because there were some in the hockey community that thought, we should have body checking as soon as we can, because the experience with body checking will really protect players from concussion later on when they're older. So that's what we wanted to evaluate in these two studies here. So at the under 15 age group, we compared those that had no body checking experience, the black triangles, to those that had 1 year, the red diamonds, and those that had 2 or more years body checking experience, the blue squares. We found there was no difference between the rate of concussion between those that had no experience in 1 year. While there was a slight decrease in the rate of concussion between those that had 2 or more years of body checking experience, the protection seen there, it doesn't offset the number of concussions prevented through policy that disallows body checking at the earlier age groups. And actually, at the under 18 age group, when we evaluated this, we found that those with more body checking experience had a slightly higher rate of concussion than those with less body checking experience. So overall, collectively, this is suggesting that more body checking experience overall is not protective against concussion. Switching gears a little bit, talk about the zero tolerance for head contact. So this is implemented in 2011 by Hockey Canada. It was a rule to penalize any player head contact, whether it was intentional or unintentional. And it was designed to help reduce the risk of concussion in our youth hockey players, which was informed by more elite levels of play. In evaluation of this policy change led by Maciej Kolakowski, he actually showed that the rates of concussion increased after this policy change at both the under 13 age group and the under 15 age group. Now, we certainly don't think that the increase in concussion was related to this policy change per se, but certainly related to other reasons. One being that greater media attention around concussion at this time, greater reporting of concussion. There was certainly the opportunity for more concussion follow-ups, so referral bias here. But ultimately, this policy change wasn't evidence informed like the body checking policy change was. In a similar research study led by Ryan Williamson, he wanted to evaluate head contacts pre and post this policy change. He actually showed that the rate of concussion or rate of head impact, didn't differ before and after this policy change either, and it didn't matter whether they were direct head contacts, so say shoulder to head, or indirect, say head to the boards or the glass. And in fact, only about 13% of head contacts, whether they were intentional or unintentional, were being penalized. So this head contact incidence and enforcement did not differ with this policy implementation. Ryan actually went to continue on with some research, and he conducted a study with youth ice hockey referees. And he showed, he did an evaluation study of youth ice hockey referees' infraction knowledge by having them watch short video clips which included potential penalty infractions. And this study revealed that referees do overall contain the knowledge to accurately and reliably make these head contacts and other infractions, but it suggests that other in-game factors like maybe in-game management and positioning may be a primary limitation for this head contact enforcement. So I think that this is certainly an opportunity for more research. Switching to some studies that evaluated mouth guard use. So we really want to highlight two papers led from members of our group, one being by Dirk Chisholm and Dr. Brent Hagel from the University of Calgary. They used a nested case control study to evaluate mouth guard use, and their study showed a significant 64% lower odds of concussion among youth players that wore a mouth guard. This was followed up by a study by Ash Kolstad, which is published last year now, but using a different study design, a cohort study design, but also showing similar protection in that lower rate of concussion among players that wore a mouth guard. And these protection levels are similar between off-the-shelf mouth guards and dentist fit, which was shown in both of these studies. Some work has been led to evaluate helmet fit. So in a comprehensive helmet fit that assessed the helmet mobility, the helmet position, chin strap fit, and the face mask fit, led by Declan Patton. That was used by Alex Gamble in a study to initially examine helmet fit and concussion. They actually showed that in this first initial study, the inadequate helmet fit was associated with a 2.67 greater odds of sustaining a concussion. I think there's also a future work in assessing helmet fit for concussion risk. And lastly, to talk about neuromuscular training or neuromuscular warm-up programs. So from a classic perspective, these neuromuscular warm-up programs include components of aerobic, strength, balance, and agility. And these studies that have evaluated neuromuscular warm-up programs have very consistently across the literature shown a lower injury and lower extremity injury rate when these neuromuscular warm-up programs are used in youth sport. And actually now we're building off of these components by including concussion-specific components, so looking at sensory motor and neck control and endurance. And when studies combine the classic components of neuromuscular warm-up with concussion-specific, we're actually borrowing on some work from our colleagues in the UK that have evaluated these programs. They've actually shown that in rugby, schoolboy rugby, there's been a 59% reduction in concussion when these programs were used 3 or more times per week. Now, we don't actually have, it's actually currently being evaluated in youth ice hockey, so which is why I'm just highlighting it from our colleagues in rugby. But this current study evaluating in youth ice hockey is being evaluated by Dr. Catherine Schneider from the University of Calgary and David Lapierre from Laval University. So I'm hoping they'll be able to share this exciting research maybe at the next CERC meeting. So I just want to acknowledge the big team that's involved in all these research projects, the funding sources and community partners, which we're going to hear from next, and really just thank CERC for the opportunity to present today.
My name is Jamie Henry. As introduced, I work for Hockey Calgary, and we're the local minor hockey association that falls underneath the umbrella of Hockey Alberta at the provincial level and Hockey Canada at the federal level or the national level. And then we have 17 member associations that fall under our umbrella. And the importance of these types of collaborations in this research for us is incredibly important in how we make structural and policy changes. One of the challenges that we face in hockey is that hockey is so rooted in Canadian culture. And what that means is we have a very passionate stakeholder base, and so they often have very strong opinions, and those opinions are often rooted in their own personal experience. So when we're looking at making different types of changes that have that as some people may view change what they feel how hockey should be played, it's really important that we have good solid evidence to support some of those changes. There's different ways that we look at changes at the local level. So one of which are things that are mandated or implemented at the national level. So an example of that is removing body checking from our U13 division, and then it's really up to the provincial level and us at the local level to determine how we roll that out from an operational standpoint. And then furthermore, we like to do things at the local level that also can impact our game and change things that maybe aren't necessarily mandated yet at the national and the provincial levels. And so it's really important for us when we're implementing that change that maybe doesn't have the mandate from our governing bodies, that we have good supporting evidence and data to help support why we're making these changes, specifically when we're faced with a lot of pushback as they may be changing core elements to the game. So I'm going to highlight a couple of those things that we've done at the local level that we've used some of this research in making some of our changes at the local level. So one of which is introducing mandatory checking skills clinics for players entering into the U15H category. And checking skills doesn't necessarily mean just body checking. Checking skills is all encompassing of stick checks, proper angling. It's really going over how to properly separate a player from the puck or to steal a puck, but doing it in a safe way that doesn't always result in a head-on collision. So body checking is a component of checking skills clinics, but it is a very small component of what is covered in that. So that's a preventative measure that we've tried to introduce to help lower the amount of incidences that we could see injuries and concussions come from. Another one is the implementation of a mouth guard policy. So that, again, using the research that Paul has kind of gone over there. So now within Hockey Calgary, it's mandated that all players wear mouth guards, which is something, again, is just a local policy change and not something that's been implemented at the provincial and national levels yet. And then the one that I'd like to kind of highlight the success for us here in Calgary is, as Paul mentioned, our non-body checking hockey leagues at the U15 and the U18 levels. So 80% of our membership plays in what we define as our community tiered hockey. And so we have 6 different levels or tiers within that structure. And so, using this research, we introduced non-body checking leagues in our tier 4, 5, and 6. So our bottom half of skill level there. So essentially, as a player, if you weren't placed on one of those top 3 leagues, you played in a non-body checking league. You also had the opportunity as a player or family to voluntarily select to play in a non-body checking league if you wished to do so. And what's really interesting is how that's taken shape over the last several years and how we've wanted to try to encourage people to play in our non-body checking league. So for instance, we've changed the names of them now. So instead of being called non-body checking tier 4, 5, 6, it's now being called non-body checking tier 1, 2, 3. Furthermore, we've worked with our provincial body, and now there's a provincial championships that's being hosted for our non-body checking division 1 level. So we're really trying to encourage that. And since then, what we've seen is, which is really cool, is more players voluntarily selecting to play non-body checking. Part of this is anecdotal, but we do have some evidence to support some of this, that level is growing for us. And there's players that have the ability to play AA and AAA hockey or have the ability to play in our higher levels of body checking divisions that are wanting to play non-body checking hockey. And so what we've seen now is that level of hockey and the skill being played at our top non-body checking level is higher than the skill of our lowest body checking level, which is counter to how it first was introduced. So we're seeing this, and what it's really telling us is that this change has been beneficial at the local level for us. And this evidence has really helped to create that buy-in and to go against some of the pushback that we faced when implementing this. But it also really shows that we need more evidence and more research, because as this is happening, now the questions are being asked is the line in the right place, right? Where should we be offering body checking hockey? Should we be offering it at all in the community levels of hockey? And so those are questions that I think are important, that we need more evidence and more research to help answer those questions. And that's why these partnerships with Paul and working with University of Calgary is really important for us to help implement those changes and to make the game safer and a welcoming place for people to play hockey here in Calgary.
Yeah, that's some great feedback there, Jamie. As we kind of move forward and look, and I think you touched on some of the challenging nuances with trying to make certainly decisions within sport and with governance. And when we start to look at making decisions to keep our athletes safe and free from injury as much as we can, relative as we know that injuries do occur. But certainly at Hockey Canada, we're trying to make best informed or evidence-informed research. And that's where the work that Paul does and Dr. Emery and Dr. Schneider and all other researchers that are out there is to give us the data, give us the information to help provide us with the direction and the guidance into our decision-making, rather than simply, making opinion-based decisions. We know that injuries are going to occur, and we still need to look to, what are the best assessments and treatments. But ideally, can we be more proactive in trying to prevent the injuries? And, certainly with Hockey Canada, the new role that I'm in injury prevention itself is to look at that. How can we prevent the injuries or try to minimize the injuries that are occurring? And we look to the research to be able to give us that information to help guide us and give us the direction that we need to be seeking. Jamie touched on the nuances on just how far-reaching that is. High performance is a closed system, if you will, in terms of looking at being able to make some of those decisions a little bit more directly. But when we start to branch out into grassroots, where we have way more, individuals and participants involved, with Hockey Canada, we have to reach out to our 13-member organizations, who then reach out to their further branches in the local organizations, as Jamie alluded to, 17 groups within theirs. It's a lot of individuals that have to come together. And you can imagine within all of those different groups, and those are just one groups of our stakeholders. And we have our players, we have our officials, and our provincial CMOs, and et cetera, within there. So that's a lot of different opinions, varying opinions, historical opinions. And so what we would really rather do is rely on the research, the data that is out there. And ultimately, we can't conduct all of that work ourselves. So we do rely on individuals to partner with, to collaborate with, to help provide us that information, and looking at it from different ways. And ultimately, when we naturally think of injury prevention, we initially draw straight to, how can we make equipment changes? How can we improve equipment? That must be the key answer, but sometimes the answer also falls within policy and within rules within the sport themselves. Looking at the age of which, body checking is involved with. What are the stages of body checking? It's not a 0 to 4. Within there, we have to learn and teach, proper positioning, proper angling, body contact. And with all that, how does that impact? So there's a lot of work that goes within that injury prevention, that we rely on the research to help us inform where are we seeing the injuries, what are we seeing the results from, what are the mechanisms of injury that are being caught on some of the surveillance data, are the penalties or the rules being enforced? And if not, how can we better educate? And a big focus of today is really around that education. How do we educate our players on coming forward? How do we educate our coaches to recognize and support our athletes? How do we educate our officials in regards to some of the rules and even within our organizations? And, what is the best way to be able to do that? And so whether that is working directly with the researchers and collaborating on them, certainly with Hockey Canada, we sit on a variety of different working groups, both with the federal, provincial, territorial working group on concussions to be informed, working with the Canadian Standards Association, their committees on hockey equipment, and trying to advance the equipment. What are the standards for testing, that should be out there? We heard a little bit about the importance of proper fitting equipment and the impact that those have on injuries. And so ultimately, the key thing that we need to do, or that we're doing at Hockey Canada, is looking at that research to help us inform our decisions. It's not always easy to do. There's a lot of information there to filter out. So by collaborating with the researchers, we can help kind of, navigate through the weeds to be able to get to the crux of how we need to make really good informed decisions. And certainly, I encourage other sport organizations from grassroots all the way to NSOs to be able to do that. Invest, protect in your participants, right? We need to build trust in our players and our organizations. We need to ultimately protect our participants within sport, and collaborating with individuals like Paul and his group really helped to inform all of that.
Thank you so much, Connie, Paul, and Jamie. That was excellent. It's so nice to see a national sport organization working with a community sport organization and partnering with researchers to really make informed decisions, using that data, using that evidence to drive policy change, to drive practice changes in order to keep your athletes safe. So I can't thank you enough for sharing your research journey, because this has been a long lasting project. So thank you so much, Paul, for sharing the research. Thank you, Connie, and thank you, Jamie, for sharing your insights. And I love your challenge, Connie, about asking other sport organizations to start thinking a little bit more like you at Hockey Canada have been doing. So I love the throwing of the challenge. Let's see who rises up to the occasion. So thank you again for joining us.